inflammation or preventing inflammation or keeping inflammation at bay with diet starts with maintaining that gut health, because those microbes are forming that protective lining within the intestinal walls. And when you have a quote, healthy gut with lots of diversity and balance, those microbes let the good stuff, like the digested nutrients, be absorbed into the bloodstream, but they prevent a lot of the junk, the irritants in our food today from entering into the body.
The information provided in this podcast is educational and not intended to diagnose or treat medical conditions.
Are you struggling with bloating, gas, constipation, and fatigue, but don't know what's causing these problems? The Gut Health Reset podcast with Dr. Anne-Marie Barter dives deep into the root causes behind these issues that start in the gut. This podcast will give you the knowledge you need to heal your gut and reset your health.
Carolyn, thank you so much for being with us here today. I'm super excited, and I just like what your message is about, because I think that this is questions that a lot of people have on how to simplify cooking. And I love that we're diving into this today.
Thank you so much for having me. Yeah, I feel like so much of the information out there makes things more complicated for people. And I really just want to bring it to a voice, just some clarity to that area and simplify things.
Yeah, I think that's the number one question I personally get asked in practice. Like, well, how do you cook? What do you do? I don't have time for that. How do we make this easier? Well, I only have this much time, so I cannot wait to dive into your simplicity tips to figure out a way to make really healthy meals. But let's just first start. And how do we know if somebody is suffering with chronic inflammation?
Well, I'm going to be honest. Most every single adult has some level of low-grade chronic inflammation in their body. And the inflammation in your body is somewhat on a continuum, and you want to keep it at the very low end if possible. But the tricky thing with inflammation in the early stages, or when you're at the lower end of the continuum and it starts to maybe pop up a little due to stress or life, or, maybe you hadn't eaten the greatest diet in the past 2 days. The tricky thing is the signs are so very subtle. They are things that you would probably never go to the doctor about. But if you pay attention to them, they are ones that aren't your body's norm. So maybe you're a little bloated, or you recognize that you're getting bloated lately after you eat certain things, or you're having headaches more frequently, or you feel like you've been eating healthy and staying active, but like that weight won't budge. Maybe if you're trying to lose some body fat, maybe your blood pressure isn't high, but it's higher than it normally is. It's getting up into pre-hypertensive. Just little things, maybe even new skin irritations, things that just aren't quite the norm for you. I like to say those are kind of like your body waving like a little yellow flag. Something's a little off. It's a little inflammation going on. That's really when it's really easy to, rein things back in and lower that inflammation. And then some of your red flags are going to be like a high or an elevated hemoglobin A1c, lipids that are, out of whack, that are not where they should be, high blood pressure, those kind of things.
So some people don't know what an elevated hemoglobin A1c is. Can you explain that?
Yeah, so it's a blood test that looks at kind of a long-term look at how your blood glucose, your blood sugar has been. So rather than, if you take your test your blood glucose, blood sugar today, they do a little finger prick and it would tell you like what it is right now. Hemoglobin A1c is nice because it's a blood test and it kind of gives the healthcare provider a picture of what your blood sugar regulation has been over the past 3 months. So it's really helpful for identifying early insulin resistance. You're not diabetic. You may not have, high blood glucose at times, but early stages of insulin resistance, hemoglobin A1c can pick up. And then it's used regularly for people who do have diabetes, just to keep tabs on how their management is doing.
Yeah, I think everybody should have that test. That's just my
I do too.
opinion. I think everybody should have it. I run it on all my patients, no matter if you're skinny or battling with weight or any of that, because it it just gives you so much information of what your blood sugar's done over the past few
Mhm.
months. And you can
Mhm.
identify and fix problems. And the sooner you can fix problems, the better off you are, because the easier it is.
Yeah, exactly.
So, since we're the Gut Health Reset podcast, how does inflammation really affect and target the gut? And what symptoms maybe would someone see?
Yeah, so I think everyone knows they need to focus on their gut health. And then, there's interest in inflammation, but I think there's a disconnect sometimes. People like, wait, how do these two connect? Or how do they, what's the influence on one another? And I know y'all probably have talked about this before, but really, inflammation or preventing inflammation or keeping inflammation at bay with diet starts with maintaining that gut health, because those microbes are forming that protective lining within the intestinal walls. And when you have a quote healthy gut, with lots of diversity and balance, those microbes let the good stuff like the digested nutrients be absorbed into the bloodstream, but they prevent a lot of the junk, the irritants in our food today, from entering into the body. So, but when that gut health is disrupted, you start to get leaks, which you'll hear referred to as leaky gut sometimes, gaps in those, in that microbial wall. And so now the nutrients are still getting through, but so are a lot of the chemicals, the irritants, the toxins in there. And anytime, once those get in the body, that's an automatic, you know, going to trigger some inflammation.
Right. So, I mean, inflammation seems like it really affects every single part of the body. It can wreak havoc in everywhere, basically. So, why aren't we talking about it more?
That was my big question. And honestly, inflammation was not even on my radar 5 or 6 years ago. Now here I am sitting with two cookbooks on quick and easy cookbooks on anti-inflammatory cooking. But inflammation first popped up on my radar when I wrote an article about Alzheimer's and the connection to food, which I really had not looked much into. And this was about 5 or 6 years ago. I wrote it, and that's what I wrote it for Cooking Light. And inflammation is a key driver of the development of those plaques and tangles in the brain that are associated with Alzheimer's. So a lot of the foods that are good, like on the MIND diet, may have a preventive effect on the development of Alzheimer's and just overall brain health. A lot of those foods that are so powerful are anti-inflammatory in nature, and that's one of the things that may help reduce people's risk. But I wrote that article, and I ended up winning a James Beard Award for that article. And I would love to say that's how I got into inflammation, but it wasn't. I kept on doing what we all do, like going through our daily tasks, my daily to-do list, writing articles on all these other health topics that I thought were so very different. And when I finally sat down and took a vacation about 6 months later and like kind of stopped to think about what I've been writing, what I wanted to write in the future, I realized, oh my gosh, all these different things, from intermittent fasting to autoimmune conditions to eating for high blood pressure, you name it, diabetes, weight loss, anything. The one thing that all this research that I've been looking through for each of these articles there's one common thread in all the research, and that is low-grade chronic inflammation is the common culprit or the common driver in every single one of these. Or in the case of intermittent fasting, lowers like the inflammation in the body typically. So, but then my question was exactly what you asked me, like, okay, Carolyn, you must not be understanding this right, because why aren't we focusing on this? Why aren't healthcare providers really zeroing it in? Because reducing inflammation is how you stay healthy, maintain your health, but it's also how you treat disease, or a part of how you treat disease and prevent disease. So then I was like, okay, I got to go back to the drawing board, because why isn't everybody preaching anti-inflammation? And, Nelson, I realized, we don't necessarily need all these separate diets, these heart healthy and, all these different types of diets for different things. We all really need an anti-inflammatory diet, because that's the root cause of everything. And then I was they're now 12 and 15, but I have two children. And my thought was, oh my gosh, so my first thought was this would be so powerful for my parent. And then I'm like, well, Carolyn, you're about to be 40. This would be powerful for you too. But then I thought, what if I could get my kids just adopting some of these habits? Imagine like how that might really change the progression or trajectory of their health, like for the next 50 years.
Absolutely. Absolutely. So now I'm like very excited. I want to know about simplistic cooking techniques where we can it can be simple. It can be one pot, how do we go about doing this, because I'm done with cooking. I'm sick of it. And I think that mirrors a lot of people's views on cooking.
Yes. And, one thing I had to face myself a couple of years ago is there's a lot of nights I don't want to cook. And I think a lot of people are in that same boat. Now, I want the benefits of a home cooked meal, of a healthy home cooked meal for my family. And I can't afford to eat out every night. But, but I don't want to, that's the last thing I want to do a lot of nights. It's like another thing on your to-do list, or at least right now in my stage of life. And, I realized once I said it out loud that it really took a lot of weight off me. I think there's a lot of pressure or a lot of guilt, particularly women feel that they don't really want to do it. They know they need to, they want the benefits, but, we don't really want to do it. And so that's really the space I was in about 3 years ago. And I'm still somewhat in it. I'm coming a little out of it, but I'm still, somewhat in it. And I thought, okay, if I feel this way and, I'm a foodie and I want the nutrient benefits, I've got to figure this out because I can't be the only one feeling this. So my goal for this one dish cookbook was to simplify even more so. I have my first cookbook, Meals That Heal, was just everyday anti-inflammatory, like the whole family would eat in 30 minutes or less. And most of them were a good fit, less than 30 minutes. But this took it one step further, this cookbook, Meals That Heal, one dish or one pot, because it is, I really try to keep hands-on work time to 15 minutes or less. It's one sheet pan, one skillet, one pot. And here's the thing, I'm not going to put just anything in my cookbook because I have foodie taste buds, but I have a dietitian mind. So it's got to meet both of those. So when I tested the recipes, if it wasn't something I felt was worth, my work at 5 or 6 o'clock, I was like, no, this one goes back to the drawing board, or let's move on to the next one. It also needed to be something that my kids would eat without minimal complaints. I feel like kids today, they want, their favorite food every night. Well, that's not happening, but it needs to be something, have some components. Oh, my earpod fell up. It needs to have some components, at least, that I can break down for them that they will eat. So I'm not cooking 2 meals.
Totally. Awesome. Do you have any simple steps that someone could follow for cooking and making recipes? Because that's where it gets tricky.
Yeah, I have never been. So I've kind of got 2, and I've outlined some of these. There's a whole chapter on how to streamline and how to even grocery shop without a real definite meal plan yet in the book. But I am not a big meal prep fan. I never really have been. I didn't want to spend my whole Sunday in the kitchen, and I didn't want to eat the same meal 6 different times during the week. But I am a big proponent of doing a little, what I call component prepping or ingredient prepping. So on a Sunday, I will make sure that I have a big batch of some kind of cooked whole grain. I will make sure that I have leafy greens on hand. I will try to cook some kind of protein that's just there to grab, to throw in last minute meals. So maybe I grill a bunch of chicken, or I, saute a bunch of shrimp, and make sure I have some cans of beans on hand, so that when I, walk in and need a quick lunch, or even need a quick dinner, because I'm not going to cook at all, or, I could just pull these components and, compile a grain bowl, or, pull out that grilled chicken and the corn tortillas and the sauce, the refrigerated salsa, and, make chicken tacos really quick. I'm also a huge proponent of finding good quality, minimally processed convenience foods. Processed foods have a really bad name, and most of them should. But there are some really high quality brands out these days. And when you find some good ones with good quality ingredients, those can really be your time savers, your shortcuts. And, I tell people, you could say, well, how do I know? And you hear the old recommendation, 5 ingredients or less. Well, it can still not be great quality with 5 ingredients or less. I tell people, like when they're buying a salad dressing or when they're buying a marinara or tomato sauce, look at the ingredient list. Does it have the same things in that list that if you were making it at home, that your recipe would have? So if it's a marinara, I want to see organic tomatoes. I want to see basil. I want to see extra virgin olive oil, garlic, maybe a little salt, a little pepper, those kind of things, and that's about all it should be. Same for salad dressing. I'd love to see extra virgin olive oil as the main oil in there. If not, then, a little healthier oil in there, avocado oil. You're seeing some come out now. Spices, vinegars, maybe a little mustard, maybe a touch of sweetness, because you do need to balance those flavors just a little. As long as it's not excessive. So you want to see like a little honey or maple syrup towards the end. But that's kind of my gauge for what I use. Does it look like, are these ingredients in this ingredient list the same as what I have in my cabinet and in my refrigerator?
Yeah. And I think I think that was a great summary of that. There's been a lot of discussion, just to switch gears, about food intolerance. And how do I know if I have food intolerances? Do you have any recommendations for that?
Yeah, a lot of times people will start to pick them up themselves, or they'll notice something isn't quite right, or they'll notice I get a sore throat after I eat this meal. They may not know the food, or, for instance, if I eat full fat ice cream, if I indulge one night, which is not on occasion, but which is on occasion, excuse me. But, nothing is off limits technically, but, I know I'm going to wake up that next morning with a little bit of nasal congestion, maybe even a slight sore throat. If I get right back on track, it's going to go away. But I've learned that, and that's a little bit of a food intolerance, food sensitivity. They are really hard to detect. And I don't know about what you have found, but I have not found, the research that I've read has not suggested that at-home tests that you can send off are very accurate at all. Is that kind of, have you?
It depends on the test.
Okay.
Most of them, I think that's totally true. Sometimes if someone's done an elimination diet, this is kind of my gold standard. If someone's done an elimination diet and they can't figure it out, then I'll run a test that's a little bit more accurate versus a lot of the ones that are just at home. But I don't start there, and I run stool tests first, because you're going to get a ton of food sensitivities if that's the case. And so it's a last ditch effort when I do a food test.
Yeah, I wish it was as clear cut as like food allergies testing, but it's not. And, I've also found these can develop over the lifespan, and it's usually related to inflammation. Like certain things may not bother you in your 20s when your inflammation is really low and you're not stressed, and, but then in your 40s, where, life is different. You're a little bit older. Health has changed a little, and you've got have a little more inflammation in your body. Maybe you're still healthy, but you have a little more inflammation. That might make you start seeing the symptoms of a food intolerance. And I'm with you. The elimination protocol, I think, is by far the best. Now, it's for people who have severe ones and really need to get to the bottom of what is bothering them. I think the classic elimination diet is great and you can't beat it. It's also hard though. So I do give, just as a starting place for people who aren't ready to do the full elimination protocol, which is about 6 to 8 weeks, if I remember correctly. I give kind of a quick, kind of a, I guess, Cliff Notes version, if you will, of the elimination. It's not 100% accurate, but for a lot of people who just maybe have some general ones that have developed later in life, it can be a good indicator where you cut out, gluten and you cut out dairy and you really kind of clean up your diet for 2 weeks, really good. And then you introduce stuff slowly. And a lot of times people will realize, oh yeah, when I drank milk after that, or when I ate cheese, I noticed some nasal congestion. You can notice small things, and that's your tip off.
What's your feeling? Because I feel like not a lot, but there's certain subsets of people that refuse to do it. Do you have any tips for just encouraging those folks that really just feel like, oh, it can't be that. Oh, it that can't be the cause of my issues or whatnot, to encourage them to maybe go forward and do an AIP diet for, a month to 8 weeks?
Give it a try. It's really, really hard. I mean, I know I would struggle to do, it for that long because it is very, very restrictive. I mean, you get great results. So I feel like I was just talking to another healthcare professional yesterday about this, and she said I did Whole30, which is essentially cleaner eating and anti-inflammatory. And she said, or my friend is doing it, and she said, I saw my friend. She said she lost 20 pounds and she has no joint pain. And it was the joint pain that, and this was another doctor, I believe, telling me this about a doctor who had done it. And I said, you know what? I said, I think until people see that connection between food and like, oh my gosh, my knees don't hurt, and usually that's a pretty quick one once you clean up your diet. But I think people, it's hard when someone just says you need to do this, but when you actually see that connection. So maybe if you can even get people, okay, just for a week, let's try to cut out dairy and gluten and minimize alcohol and chemicals, and just do it for a week. Do it for 5 days. You can't do 7, do it for 5 days and tell me how you feel. Are you sleeping better? How your joints feel? Headaches, bloating, So I think if you can help them connect the dots, maybe starting there with just a baby elimination and connect the dots, because I think that is really what motivates people when they see, oh my gosh. And then when they go back to their regular eating, assuming they do, when they feel like horrible the next week, that's when they really have that aha moment, like, oh my gosh, food really is impacting me. Yeah. But you've got to meet people where they are. And, full on elimination is hard. So sometimes if I can just get people to do 5 to 7 days, they figure it out themselves. And, then, okay, I'm going to start here by cutting out this and just see, baby steps.
Awesome. Well, where can people find you if they want to get in touch with you?
Yeah, so I'm most active on social media on Instagram. My handle is realfoodreallife_RD. I'm Carolyn Williams. You can also search my name. I also have a website that's carolynwilliamsrd.com. I'm sure you'll put all this in the show notes. And then my newest cookbook, Meals That Heal One Pot, is coming out, I believe, September 28th. I'm so excited. And you can pre-order if people are hearing this before that date at any online, Amazon, any major retailer, and you can get the book at all those places as well.
Awesome. Well, thank you so much for being here and sharing your knowledge. It's been great to have you on the show.
Thank you. I enjoyed it. I appreciate y'all having me.
Absolutely. Take care. Bye-bye.